welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And here at Gold, we are preparing for our Gold Neonatal Online Conference. And with that conference, we also have some exciting add-on packages. And one of our speakers is here with us today for the conference, Dr. Teresa Puthoff. Very nice to meet you here.
Nice to meet you as well. I'm glad to be here.
Wonderful to have you here. I am very excited about your topic, which is advanced postoperative pain management strategies in the NICU, a topic it's so needed. We need that information out there. We're going to talk about that in just a moment. First of all, Teresa, where in the world are you located?
I am located in Columbus, Ohio at Nationwide Children's Hospital.
Nationwide Children's Hospital, a famous hospital. Yes, indeed. That's wonderful. So tell us a little bit about your background and your professional journey.
My professional journey, I started out working as a staff pharmacist for a short period of time. And then I began working in a large delivery center that delivered, I think, right around 1,000, no, maybe 3,000 babies a year.
Wow,
we had
big,
1,000 admissions to the NICU each year. So it was a relatively large neonatal intensive care unit. And I worked there for about, roughly, I'm going to say 12 to 13 years. And then I moved to Columbus. And here I'm working in a large referral center, level 4. We see quite a variety of different types of patients here. And we do have one of the largest neonatal surgery centers in the country here as well. I've always had an interest in pain management, and that was one of the reasons that I came here to Nationwide. I thought I would have quite a bit of opportunity to work not only with nutrition in our postoperative patients, but be involved in their pain management as well.
Well, thank you for sharing that. Yes, indeed. And pain management, I can imagine you're very passionate about this topic. And specifically here now with the topic of the presentation, pain management strategies in the NICU and the NICU there. And it baffles me thinking back, not if you think of it, not that very long ago, when we thought that, or when, the medical profession thought that little ones in the NICU, preterm babies, did not experience pain the same way as full-term babies did. And pain management was not as advanced as it is now, right? And here we are today, and a lot has been done, but I feel like there's still a lot of potential. Isn't that right, Teresa?
I totally agree. I was personally taught that premature babies do not have the ability to perceive pain. And that's how I practiced in the early years until I would say, literature publications suggested otherwise. And then that led, I think, into the 5 rights, I think it was, where we felt that pain was the 5th vital sign. And so I would say we paid much more attention to analgesia at that time, but we still didn't know the best way to optimize pain management and yet minimize the adverse effects associated with those drugs and the various gestational ages that we care for in our NICUs.
It is, I can imagine, a very tricky situation. On one hand, you obviously want to manage the pain appropriately. No little one should be in pain, right? But on the other hand, there is, of course, these are strong drugs. We're talking opioids and other drugs like that. Obviously, we don't want a dependency on drugs like that, and how to dose that right. What have you learned over your years?
What have I learned? I think one of the most important things that I've learned is that if we are going to provide a procedure that we know is painful, we should preemptively treat the patient to minimize the risk for pain developing. If it's a postoperative patient, we should try to manage that pain as quickly as possible. And by doing so, that typically means that they will have a shorter postoperative course in terms of the amount of opiate that they require. So I guess I can say that we need to try to minimize the sensation and incidence of pain wherever possible, whether that's pharmacologically or non-pharmacologically.
I know you are in the pharmacological side of things, but I have read interesting studies and research also on other methods of pain management, such as, of course, kangaroo care, skin to skin, and as well as breast milk, right? Have you seen anything like that as well?
Yep. A couple of the articles I'm going to talk about today talks about an approach called sensorial saturation, which basically means stimulating the various senses that the baby has, and that if we do that well, it may be more beneficial than a dose of an opiate. But I think it's time intensive for the bedside nurse. So I think the challenge in the future may be, how do we provide opportunity at the bedside to provide that type of stimulation for painful procedures? Do we need more nurses? Do we utilize the parents? And if the parents aren't available, how do we provide that kind of multisensory stimulation to manage pain?
Wonderful. Yeah, thank you. Thank you for sharing that. Fascinating there. And as you said, there is a labor intensive for the bedside nurse. That is, a difficulty, of course, but hopefully with all the strategies in place or coming into with partnering with parents and such, we can do a lot more there as well. That would be absolutely fantastic. Absolutely fantastic. Now, with regards to your topic about advanced postoperative pain management strategies in the NICU, what else can we look forward to learning in this presentation?
We will learn primarily some of the strategies that we have utilized at Nationwide that has allowed us to reduce our opiate delivery to our infants in our NICU. And that includes regional analgesia, which is commonly termed as epidurals, nurse-controlled analgesia. We are also beginning to use wound catheters in our NICU, which is a brand new modality. And we will also review a project where we used I'm going to say an alternative sedative after tracheostomy that allowed us to quickly reduce the amount of sedation required after tracheostomy placement.
Wonderful new strategies there. I can't wait for that. And I'm very interested also in the wound catheter that you are describing there, because I think it, as it's so new, there is still so much for us to learn on this, and I'm looking forward to it. Well, thank you so much, Dr. Teresa Puthoff, for spending time here with me, talking about the wonderful work you're doing there at your hospital, and also, of course, the presentation you have here with us at Gold. Thank you. It was a pleasure having you here.
Thank you for having me.
And now a word for our viewers. If you are interested in this presentation and want to learn more about all the other presentation here at Gold as part of this lecture pack, we invite you to go to goldneonatal.com to find out more as well. And this presentation will be available on May 30th. Thank you, everyone, for watching, and have a lovely rest of your day wherever you are in the world. Bye-bye.